as you know, heart diseases have three big enemies. If your heart is not healthy, everything else is being affected by it. When I tell my patients, you cannot eat this and that and that, it's very hard. You can't really tell patient not to eat sugar, not to eat pizza, not to eat, all those foods, right? Life will change. You'll see the difference. You will think better. You can do more. You have more energy, right? All those. I shouldn't say that, but I try to do exercise as much as I can, but it's very difficult sometimes due to my time and my busy schedule.
Assalamu alaikum again, guys. Welcome back to the Path You Take podcast, where the path you take is the path you make. Alhamdulillah, I'm joined here today by respected Dr. Hurmat Ali. Assalamu alaikum.
Walaikum assalam wa rahmatullah. Thank you so much for inviting me over.
Thank you so much for coming. I really do appreciate your time and your efforts for coming here today. Why don't we begin by just maybe introducing yourself a little better, a couple of things about yourself.
Sure. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum.
Alaikum assalam.
Well, it's difficult to talk about yourself, but since you are asking me to introduce myself, so basically my full name is Muhammad Hurmat Ali, and I'm a family physician by profession, and I have a clinic in Cloverdale area, and I see patients, inpatient, and I used to do some hospital work in the past, and because of my busy schedule, I decided not to do that. But I graduated in 2012 from medical school in Poland. Then I spent a couple of years in Malta, did my residency there. Then I came to Canada in 2015-16, early 2016. I did my residency in Kelowna, UBC Family Medicine Program in Kelowna, completed my residency and return of service there. Then I came back to Lower Mainland, and alhamdulillah, I've been practicing for the past roughly 6 years now.
MashaAllah.
Alhamdulillah. Yes.
Alhamdulillah. And how did you find yourself taking career in medicine?
It's a long story. For the purpose of time, I would like to just give a brief,
for sure.
history here. So initially, I was not into medicine at all.
Okay.
I was actually doing my undergrad in New York City, and I did my bachelor in sociology, and I entered university in New York and doing my master's in computer science. So my major was nothing to do with medicine.
It's like the furthest thing away you could get from medicine.
Exactly. So I was not into medicine at all, as I said. I was doing computer science, and I was literally 2 semesters away from graduating from my master's program in computer science. During my last 2 semesters, an incident happened which totally changed my path and career towards medicine. And that was my father. My father actually had a heart attack, unfortunately, at that time. And it was a big one. He was basically gone for like 20 minutes. They had to revive him back with CPR. And, so that incident was really eye-opening.
Yeah.
I had the flashback now.
Put everything in perspective. Yeah.
Exactly. So it was an eye-opening for me. Alhamdulillah, my father made it.
Alhamdulillah.
And alhamdulillah, he's fine now.
Alhamdulillah.
With
long life, inshallah, health, wealth, everything.
Jazakallah khair. Thank you so much. So that actually changed my life, and I started thinking maybe Allah subhanahu wa ta'ala is giving me some sort of signal. Maybe I should go towards medicine. Then after I started looking into career in US for medical school, but since I did not have strong background in pre-medical sciences and all that sort of thing, if I had to start in US, that would have taken me a lot of years.
Probably pretty much starting from the beginning all over again.
Exactly. But the good thing about my undergrad was I had the basic sciences, like chemistry, organic chemistry, and physics, and whatever that I had to do. I already had those pre-medical courses done, so I didn't have to do them. But even though going into medicine, I had to take an MCAT, I had to do so many examinations, and
lots of preparation. Yeah,
definitely. So that I would have to probably waited for 2 years or 3 years before I even go into the medical school.
Yeah,
and therefore I looked into other areas where I can actually go into medical school and try to finish my medicine degree. So I looked at Caribbean schools, I looked at European schools, and after discussing with some of my friends and family, I decided to go to university in Poland, where I graduated from medical school in 2012, alhamdulillah. Then after that, I got married in Vancouver,
Okay,
Canada.
that's what I was going to ask. Or how,
Exactly.
all over the place. How do you end up here?
Yeah, yeah.
I'm glad that you are here,
It
but
was,
just,
it's a destiny, and
destiny,
it's a
mashallah,
destiny,
yeah.
qismat, right? You come here.
Yeah.
So I got married here, and then at that time, I basically people were telling me, if you are an international medical graduate, it's very, very difficult to get into the Canadian system, into residency programs. It's very, it's unlikely. Don't even try. This was I was getting from my friends and what were colleagues at that time telling me, but I never lost hope in Allah Subhanahu wa Taala. You should always, if you want to do something, you will be able to achieve it. You have to just have the right mind, do your best, and then Allah Subhanahu wa Taala will help you.
The biggest barrier you have is always yourself.
Exactly. Yeah. So to increase my chance for getting the residency in Canada, I went to Malta for 2 years.
Yeah.
And I did my house job, it's house officer, they call it. It's like a foundation program. It's like a UK program, foundation program. That I did that for 2 years, and I practiced medicine there for like a few months before I came here, and I started doing my exams, and alhamdulillah, I matched to UBC Family Medicine program in 2017 in Kelowna.
MashaAllah.
Yes.
It's a long journey, different route, and that's always interesting. Like, especially when I'm always sitting down here on the other side and hearing people's stories. They're always like in a different type of area, and then something happens, and they kind of just segue into something totally different.
That's right.
Right, and that's always the beauty of it. There's always a sign. Even when it comes to, like, as you said, what opened your eyes was your father had an traumatic incident where it was a heart attack, and heart issues are always it's always, I always describe it as a monster that it takes lives, and
exactly.
And a lot of people oftentimes think it's just hereditary, but is it only hereditary in your eyes, in your knowledge, or can people take actions from now to kind of hope steer themselves away from that type of stuff?
Well, for the heart is basically we have modifiable risk factors and non-modifiable risk factors. I like to divide it into two categories, right? As you said, non-modifiable risk factors, you can't do anything about it. Unfortunately, if you have it, you have it, right?
Yeah.
If you have it genetics, you have it. You cannot change that.
You can't change it.
But on the other hand, the modifiable risk factor, definitely this is something that you need to work on it from early on, right? So as probably most of high blood pressure, high sugar, smoking, and lack of exercise, stress, all those are the risk factors that we can work on, right? Well, blood pressure and diabetes, if you have genetics, then you can't really do about it, but you can actually delay the onset, or you can actually some sort of control it, right? With correct lifestyle, diet, and possibly medications, right? Because as you know, heart diseases have three big enemies. One is blood pressure, one is blood sugar, and one is cholesterol, high cholesterol. If you can tackle these three enemies, inshallah, your heart will be able to work efficiently.
MashaAllah. And just in terms like simple terms and stuff, like how does the heart work? Because you're saying all these types of enemies, but sometimes in order to kind of know how to defend yourself, you got to know how does the mechanisms work? How do they put it to each other work, and help live life and prolong your life?
Well, heart is a very complex organ.
Yeah.
And it's very difficult to just within our talk show that we have here for like 20 minutes, half an hour, is to describe every single mechanism and how it works. But in a nutshell, as you know, heart is a pump.
Yeah.
And what is the job of a pump? The pump is basically, it just pushes anything like blood or water or whatever we have, right? So heart is a pump. It takes the blood, your blood, which carries oxygen and nutrients to different organs in the body. It's like an engine, if you want to say it. It's a very simplified word. If your car's engine is not working,
the car will go,
exactly, right? So it's like your engine, right? If your heart is not healthy, everything else is being affected by it. So your kidneys would shut down, your brain would shut down, your eyes wouldn't work, right? So everything is related to the heart, and you have to really take care of it, basically.
Yeah, so take care of your heart, both health-wise and love-wise as well.
Exactly.
There you go.
That's right.
So you also said, keeping active and the diet and all that type of stuff. So what kind of activities in terms of keeping active, like exercise? are best in terms of keeping up that health?
Well, according to Canadian guidelines,
Mm-hmm.
they usually suggest that minimum of 150 minutes of exercise per week
Okay.
is recommended for anybody to keep themselves active and healthy. It doesn't matter what kind of exercises. You just have to do it. You have to just increase your heart rate.
Okay.
If you're doing any exercises is not increasing your heart rate, you're not doing anything. You're just wasting
You're
time
wasting time.
and
You're playing video
energy.
games pretty much.
Exactly. So
Yeah.
get out there. Basically, it could be a walk, could be a run, could be, gym exercises, could be treadmill,
Mm-hmm.
it could be hiking, weekly hikes, or even daily hikes if somebody can do it. Yoga exercise is good, but I think you need to do something more to elevate the heart
To get
rate.
the heart pumping more.
Exactly,
Okay.
heart rate going a little bit, and this is how you basically can keep yourself in shape as well,
Mm-hmm.
which will in turn will help you to avoid getting diabetes and blood pressure, because a lot of time obesity is linked
Yeah.
to many of these diseases like blood pressure, high blood,
Obesity is
diabetes,
a big
sugar.
killer.
Definitely, and unfortunately, majority of patients in Canada and USA is dealing with that.
So when you say obesity, is it most of the time dealing in terms of like, again, me just speaking from a place where I don't know too much about obesity myself, but is it hereditary or is it like a, binge eating disorder where they just eat too much, or how does one find themselves in that kind of situation where they become obese?
It can be hereditary, yes. Yes, unfortunately, if you have the gene, then you can go to that direction. But on the other hand, there are other causes can lead to overweight or obesity, such as low thyroid. Like, there's a thyroid gland that we
Yes,
have.
yeah.
If your thyroid is not working well, then it can increase your weight. It can lead to increase of weight. Um, Lack of activity, as we already mentioned, that obviously if you're putting more calories in than
And
expending
expanding, yeah.
it, so
You start adding up the
obviously
pounds.
you add pounds, right? Or the other way around, if you are spending more calories than putting things in, then you're gonna be more fit.
I know about that way too well, especially during COVID. I put on
Right,
pounds on pounds.
that's right.
It
Yeah,
was it
because
was
people
horrible.
sitting
I
at
was
home.
sitting down, yeah, sitting
Yeah,
down playing games with the friends and all that type of stuff, late
right.
nights and Ramadan during COVID.
Yeah,
Oh my day, I was eating all night, and I found myself where I gained 30, 40 pounds, and I was alhamdulillah over the past last year I lost 40 pounds, so I feel a lot better
alhamdulillah,
now.
that's
But
good.
obviously keeping track of your calories and making
That's
sure
right.
you're burning more than you're eating, and then
Exactly.
obviously you know a lot better when it comes to diets than
Mm-hmm.
I do. But what would be a proactive diet, a healthy diet one can where you don't really kind of stay away from stuff that you want to eat,
Right.
like cake,
Yeah,
cookies.
yeah,
Sometimes it's good
yeah.
to have 2 spoons of sugar in your chai, where you could have a balance. What's the perfect balance when it comes to that?
So obviously, all the good foods and tasty foods are not good for you.
Pizza, burgers, fries,
It's
yeah.
like a rule of thumb. All the untasty food,
Yeah,
unfortunately, is good for you. But jokes aside,
yeah,
um, when I tell my patients, you cannot eat this and that and that, it's very hard. You can't really tell patient not to eat sugar, not to eat pizza, not to eat, all those foods, right? I tell them you can eat, but in moderation, in balance. If you balance your meal out, let's say you have more fruits and vegetables and, all those healthy snacks and, foods, then maybe you can have a cheat day. Maybe on Fridays, Saturdays, whatever, you can have one day that you can eat, right?
mhm,
But try to keep what you're eating, diary for it, and keep a diary what you're eating and what foods are actually good for you. And avoiding processed food is
yeah,
actually very, very important, right? Um, Especially for patients with diabetes and high blood pressure, uh, foods like high carbs, high sugar, those are the food that we generally tell them that try to limit
yeah,
and try to add more fiber or more lean protein, right? Lean meat, for example, is actually more healthier in terms of healthy snacks kind of thing, right? Maybe legumes, right? Those
beans and stuff.
beans
Yeah,
and all this stuff is actually more protein based kind of things, helpful. And again, I'm not saying don't eat the other stuff as well, because you go to center, you go to masjid.
That's what they give you. You know, they have the chai with 5 cups of sugar inside
Exactly,
too, and then
yeah.
they give you the cake and the croissant and your
And biryani.
biryani, and there's never the salad.
That's right.
Or
Yes.
maybe there is a salad, but it's just
It's
in the
finished by
corner.
the time you get
Finished, or it's been in the fridge because no one wants to because they want to eat the biryani instead, right?
Yeah.
So that's always an issue
Yeah.
I'm facing as well. But yeah, in terms, so when you said lean meats, so we're talking about like lean steaks and like chicken breast,
Yes.
that type of stuff, right?
Yes. The high protein.
High protein.
Exactly. Yeah. I know they're expensive. Unfortunately,
I know,
all the
I
good
know.
foods are expensive, but it's,
Trust me, I
it's
know.
healthier.
Like especially when I was going on the cut,
Yeah.
when I was losing weight,
Yeah.
every day it was like in the morning I would have like 2-3 eggs,
Yeah.
no bread,
Mm-hmm.
no bread at all. Maybe a little bit of cheese if I'm
Yeah.
spoiling myself a little
Yeah.
bit, but and then have like a really lean steak.
Correct. Yeah.
You know, steak and eggs in the morning, sometimes
Right.
eat steak and eggs again for dinner.
Right.
I found like the first week was horrible.
Yeah.
I was digging myself in a hole of depression.
That's
and,
right. Yeah.
And I really wanted to quit, but
Yeah.
alhamdulillah, thankfully my wife kept me on track. She's like, hey,
Alhamdulillah.
you gain a couple pounds, it's time to
Yeah.
let them go.
Yes.
Right? That's always a barrier.
It is a barrier, but you get used to it.
You get used to
Because
it.
your taste buds right now is kind of used to all the sweetness and sugar and all that stuff that we eat every day.
Is sugar as bad as they say? Like it's equivalent to cocaine in terms of how you get addicted to it?
Yes,
Yeah.
it is an addictive,
Yeah.
but it's something that if you train your body, I tell patients 40 days. In Islam also
It's
we have
always 40 days,
40 is a holy number we have.
Yeah.
So 40 days, if you can really work hard and avoid those, you are going to, your life will change. You'll see the difference. You will think better. You can
Yeah.
do more. You have more energy, right? All those, because sugar gives you false energy. You get the
get the
sugar
high.
in, you get high.
Yeah.
You want to do everything. Just an example: if you have a kid, like
I know, yeah.
give them chocolate or candy. You know what happens 10 minutes
They're
later?
an airplane. They're running
Exactly,
around. Yeah.
exactly. So
No,
this
I
is
know.
how it gives you false energy, and then suddenly you just deflate,
You
goes
crash.
down.
Or and then you take more.
Exactly.
Yeah, to get that high. Even again, just from my own, those 10 days of the first week was horrible. But then I saw myself thinking a lot more clearer,
Right.
having a lot more energy, even though I'm not eating too many carbs and not too many sugars.
That's right.
Having a balance of fats as well, is that a good thing? Like I was trying to get some
course.
fats, like the olive oil, avocados,
Oh yes. Oh yes. Definitely.
grass-fed butter, that type of stuff.
These are good fats, we call it, right? Good fats, or we have HDL in medical terminology. It's a good cholesterol. We have bad cholesterol and good cholesterol. So HDL are good cholesterol, which we encourage patients to take more.
Yeah.
Like avocado, as you mentioned, olive oil, almonds.
Almonds.
Having raw almonds, maybe like 5 to 10 pieces every day would be a good idea. And exercise in general also increases your HDL. So I tell my patients, maybe have some half avocado mixed in the salads or something
Yep.
to eat every day.
Or guacamole, that goes a long way.
There you go. Yes. And maybe replacing their oil, instead of using canola oil or vegetable oil, use it with olive oil, for example,
Yeah.
or avocado oil. They're healthier oil, right? You can use it so that can, improve their overall cholesterol levels, basically.
Yeah. So I know you were saying olive oil, avocado oil. I've recently, as you can see, social media and just everybody culturally right now they're more towards this health grind in terms of making sure they're more fit and their diets are healthier and all that type of stuff. And now I'm seeing this big uprising against seed oils, and they're horrible for you and they cause cancer and they cause X, this, Y. A lot of times scientifically backed, other times just you have some high profile individual
Yeah.
just making these crazy claims. Are seed oils that dangerous for you?
There are mixed reviews on them.
Yeah.
Whatever you see on social media, try not to believe them, first of all. So it's better to listen to your own doctor, because we have doctors. I mean, why do you want to go on something that is we don't know where the source of information is from?
Exactly.
Right?
Yeah.
So if you have your own doctor, talk to your doctor. Open a book, maybe do a scholarly research, to read them about them yourself, instead of watching a 30 seconds
Exactly.
reel for somebody.
Or a different podcast like ours where they just sit down there and say seed oils is the worst thing in the world. Do not touch that. You're gonna kill yourself, kill your kids, kill your
Right.
parents. I'm looking at myself. I just fried some fries using canola oil. I'm like, am I that guilty right now? Obviously, because sometimes olive oil is a lot more expensive.
It is more expensive. That's right. As I said, healthier stuff is more expensive, and but your health is
It's even more expensive. Yeah.
exactly. You need to look after your health, because if you lose your health, you're not gonna get it back.
Exactly.
Right? It's hard to get it back. Let's put it that way. Let's say God forbid you have a heart attack, like my father.
Yeah.
He had a heart attack. Thankfully, Allah subhanahu wa ta'ala bring him back,
Alhamdulillah.
but it can go the other way around too. What's then, right?
Mm-hmm.
So if you can prevent from happening, especially if you have a bad genes in your family, if you have a family history of heart disease,
Yep.
family history of diabetes, family history of blood pressure, you look after yourself pretty
I
well.
have all of those, so I know. That's where I had to cut back.
That's right.
Yes,
Yeah.
I have my mom. She suffers from angina, so
Right.
that's she has a heart disease, and then my grandma has diabetes, and my other grandpa has diabetes.
Right.
So and then other family have high blood pressure and high cholesterol. So
Exactly.
I got away with all of that stuff, and always, you know how moms are. Just watch yourself. You're gonna get this. You're gonna get
Yes.
that.
Yes. Exactly. So watch yourself now, so you delay the on. Sometimes you cannot avoid them.
Yeah.
You will eventually get them because of the genes, but you can actually delay the progression, delay the onset.
Delay the onset.
Yeah.
Well, that's a good way to do it. Just always delay it, and then you just again. So seed oil is not too bad for you. Just the right back.
Seed oil, it's basically, I'll tell you this way.
Yeah.
Oils have degrees.
Yes.
Bad, worse, bad, good, not good. There are degrees here. So I would put the seed oil somewhere in a lower, and like not super high. So people, if this is what you're comfortable
For
with.
like occasionally,
Yeah,
for your
fine.
French fries,
I'm okay with that.
so that's
That's
fine.
okay.
It's fine.
Yeah, that's fine. Yeah.
But not for like every single.
No,
consecutive
yeah.
day.
As I said, olive oil, avocado oil are the best kind of oil. You can use it. And again, in general, oil, you should watch how much oil you're using for anything, right? But if you really want to, fry your food, those are the things that I would, excuse me,
No worries.
those are the food that I would basically suggest.
Suggest those.
Yeah.
Okay.
Yeah.
I this is something I heard as well. I was reading up a little bit on in terms of you're saying you got to take care of when you eat healthier foods. You feel healthier, and mind feels better as well. In terms of like having your gut related in terms of your hormones, your thyroid, your brain, your mood. Personally, I found that, changing my diet was, helped impact my mood,
Right.
in a way different way. So waking up earlier, I could, even go off of only 4 hours of sleep. Next day, I'm good to go.
Right.
Is it that related, in terms of the gut-brain axis, having those two, they're connected in such a strong way?
The entire body is connected. I would put it this way. The
Everything,
entire body
head
is
to toe.
connected, head to toe. Even I say some of my patient comes and tell me I have acne, pimples on the face. So I tell them, look at your GI health, look at your, health, what you eat.
Yeah.
Because it's all connected. If you're eating obviously fried food, if you're eating unhealthy food, sugary food, not drinking enough water, obviously it has to present somewhere. And sometimes the acne can be presentation of your GI health. Sometimes simple, changes in the diet and lifestyle can improve a lot of things without even giving medication. So definitely, I agree with you 100% that you need to look at every single aspect of your health and try to follow, again, diet and exercise. If you follow these are the two big, like I would say, golden key to your overall health, and you won't be complaining. And doctors will be just sitting and waiting for patients in the clinic.
We'll put you out of business right
Yeah.
away. Yeah, inshallah, you have a long success.
Same to you.
So yeah, so diet, so health, your diet and then exercise. Would you outweigh one over the other? For example, let's say you have someone who they can only focus on one. Meal prepping takes time. Exercising also takes time. Sometimes you can't do both. Which one would you tell someone to focus on more? Their diet or, be more active?
It's a hard question you're asking.
I know it's a difficult one because even for myself, sometimes like, should I prep my food a day in advance or should I go on the exercise back for an hour?
Well, I would say both of them are important on its place. I mean, it's very hard. I mean, if you really have to pick, obviously diet is important. You have to look for diet, watch out what you're eating. But exercise, you don't have to spend time in gym. Just walking. Like for example,
Just get your steps up.
Yeah. For example, if your work is not too far from your house, just bike to your work or walk to your work instead of just driving. Because sometimes what we do, even if you want to go for grocery, like literally 2 blocks down the road, you take your car, right? If you can just walk to that's enough. Like slowly, if you have a backyard, just do something in your backyard. Play with your son, play with your kids.
Yeah.
Something that little bit increase your heart rate. So that should be better than nothing.
But of course,
Better than nothing,
some
right?
people are better than
Even
nothing.
though the Canadian guidelines say 150 minutes of exercise, like, vigorous
Yeah,
exercise.
elevated heart rate
Exactly.
consistently, right? Yeah.
Right, but better than nothing, right? But diet is definitely important. Exercise is also important.
So when we're talking about rigorous exercise, is there a certain heartbeat level you want to be staying above of? Like, or is it different for person to person? Like, is
It
it over
depends.
100, or what's like where I'm like, okay, I'm hitting 120 beats and I'm considering doing that consistently for an hour,
Well,
or
it's I don't think everybody have Apple Watch to watch their
yeah,
heart rate, what it goes to. But I would give you one key point to watch out for. If you are doing an exercise and able to carry out conversation like we are doing right now, you're not
you're not
doing
doing it
anything.
right. Okay,
You have to start, breathing faster, and you maybe are sweating a little bit. So
okay.
this is where you are. Yes, this is where it counts.
Then so you're
Exactly.
not having an asthma attack. You're just pushing hard.
Exactly.
Okay.
Yeah.
That's even what I found for myself a little bit too, which was very interesting, was in the beginning it was hard to keep the heart rate up, but then eventually I'm doing the same level of terms of how much effort I'm putting into the exercise, but my heart rate is not. I have an Apple Watch, that's why.
Yeah.
My heart rate isn't going as high as it used to be,
Uh-huh.
and then I'm able to carry out conversation. Is it because like I trained my body to handle that stress better,
Yes.
or
So for trainers,
Yeah.
like experienced trainers, they have to work even harder because their resting heart rate is actually lower than the general public. For example, if I take your heart rate right now, probably it's going to be around 50 to 60, even lower, maybe it's lower than 60, most likely. But for somebody myself, which I don't, I mean, I shouldn't say that, but I try to do exercise as much as I can, but it's
Yeah.
very difficult sometimes due to my time and
of
my
course it takes time.
busy schedule. Heart rate maybe my heart rate maybe more than 60, maybe 70, maybe 65. I don't know, right? But for experienced trainer, they should be able to carry out the exercises, and they should feel a bit of fatigue. They should feel a bit of tiring. That the muscles are like their muscles start producing some
Feel a little
acid.
sore the next day and
Exactly,
everything.
lactic acid we call that, and they can start feeling the soreness. They feel that there's something is happening. That should be enough for them. But for majority of the public that we have here, unfortunately, they're not going to the gym, so they are basically average. So they will be able to see some sort of changes in their breathing
Yeah.
or in their heart rate. You will see that your heart is going faster.
It's going faster, yeah.
Exactly.
That pissed me off because the other day I was on the bike and I was like, usually if I'm on the bike for an hour, this pace, my heart rate should be like 150, 160, maybe 170. I should be gasping for air. I was like, is this good? Is this
You're
bad?
fit.
No, I mean, I still have a little bit of a belly, but alhamdulillah, I feel like my endurance has grown a lot.
Alhamdulillah.
Just strictly do again.
Yes.
Diet, exercise, skipping, kickboxing, keeping that type
That's
of
good.
stuff up.
Alhamdulillah.
It went a long way for me. So
Alhamdulillah. One thing I should mention here, if somebody's trying to lose weight,
yeah,
maybe it's easier to lose weight, but to maintain it is difficult. So some people are very like, oh yeah, I want to lose weight. Let's do it. Let's do it, right?
Exactly.
They do it for maybe 6 weeks, 2 months, 3 months. They go into it. They get very happy, and they just start losing the trend that they started off,
You get a little too
which is
comfortable
very
again, yeah.
unfortunate because once they gain the weight again, they will lose all the hope. Then they are not going to try as hard as before. So my suggestion to them, don't push too hard. Like, if you want to lose weight, lose over time. Don't, within 2 weeks you want to lose like maybe, I don't know, 10 pounds or
Yeah.
15 pounds or whatever, right? But try to maintain it. So whatever you're doing, make a habit of it. Make something that you can carry on with this. Like our prayers, like we do alhamdulillah 5 times
5 times a
prayers,
day, yeah.
right? Allah made this for us. Allah subhanahu wa ta'ala made this that we need to do this, right? If you can similarly make the same habit that you need to do this every day,
Yeah.
then it'll become part of your routine, part of your daily activity that you can carry on.
No, I agree with you with that 100%. And especially like for me wise, when I started the journey, it took me like 3-4 months to lose. It was about 10 pounds a month. That was 8 months ago. So that's way past. And I'm still good. I've been always, one thing that I got addicted on was hooked. Now it's like a ritual, whether I'm working out or not.
Right.
As soon as I wake up, I check myself. I check my weight.
Yeah.
I look at them like I gotta make sure I'm staying below 155 at all times.
Inshallah.
If I'm not, then I'm gonna have a difficult week ahead of me where I'm only eating salads, right? But that was always a thing. Like, I worked so hard for it. That's why I just,
MashaAllah, yeah.
if it goes away and I gain the weight again, and then all of a sudden I already gave away all my bigger clothes and I already downsized, the whole wardrobe will have to change again. That's always frustrating.
Definitely. And the problem is the other issue is mental health
Yep.
that's associated with it, right? So once you, again, if you work so hard and you gain the weight again, a lot of people come to, like my patients come to me and they go into depression, for example. They go into very low mood. They, they don't want to do anything.
Not motivated
and
anymore.
Not
right?
motivated anymore. So it's very difficult. Then it's gonna be a problem. Then this is gonna be like a chain reaction. They're gonna stay like that, and we have to treat them, treat the depression. Then
Yeah.
we start all over again. So you don't want to go there. Just
Of course
prevent
not. No, of course you don't
from
want.
you
Yeah.
from getting there. Yeah.
That's where I can just keep myself in check. That's always because I know if I get it back, I'll probably you'll see me right away. That's what's gonna end up happening. That's always consistency, right?
Right.
Just having that ritual where you follow yourself
That's
up,
right.
you follow up again, and consistency is key. And when you repeat something, it becomes a habit, and once it becomes a habit, it becomes part of your daily schedule, and it's different. In terms of again, you were talking about as well as diabetes before. We touch base a lot of cardiovascular health and your heart rate. Now just a little more on diabetes. Are there healthy sugars, unhealthy sugars? Should people watch out for? If I eat a lot of sugar early on, this is something my grandma used to tell me. If you eat so much sugar in your younger days, you're gonna end up having diabetes when you get my age. Is that true? Not true?
They're partially true. That's partially true. Obviously, if you eat a lot of sugar,
Yeah.
a lot of unhealthy snacks, that leads to obesity, which, as I said already, links to
diabetes. Yeah.
higher risk of getting diabetes. Again, diabetes has two types.
Yeah.
As you already know, type 1 diabetes and type 2 diabetes. Type 1 is basically more common in younger children and adults.
Early onset, right?
Early onset, exactly. So this is like strongly related to genetics. So if your family has this issue, then most likely you are going to get it. Not everybody gets it, but it's higher risk of getting it.
Yeah.
Exactly, higher risk of getting it. And the problem with type 1 diabetes is that your pancreas, which is the organ responsible to produce insulin, which is a hormone produced by the pancreas to control your blood sugar, that insulin is not there. It doesn't get produced, basically. And when you don't have insulin, you obviously have higher sugar in your body, and which in turn damages your organs, the kidneys, your nerves, your heart, brain, eyes. So a lot of complications associated with diabetes type 1. On the other hand, type 2 diabetes is a problem with the receptor, which means that the insulin is there, but the body doesn't see it. It doesn't use it. So a lot of insulin is lying around, but the body cannot take it in, and the sugar therefore cannot get controlled. And usually this type of diabetes is more in adults, in like late onset, we call this kind of diabetes. And it is related to obesity, as I mentioned, is related to your diet and also genetics, basically. So as I like to divide this into modifiable risk factor and non-modifiable risk factors. Non-modifiable, again, genetics. You can't do anything about it.
It is what it is. Yeah.
But exactly. But you can actually delay the onset as well by, again, diet and lifestyle, which has already we talked about. Modifiable risk factors like smoking. So smoking obviously is very, very bad.
Nicotine,
Nobody
tobacco,
can come and tell me, doc, I found this research. This is good for you. I said, no.
Like, I don't know if you heard about it. Was like they're saying nicotine boosts testosterone in men. It's very healthy.
I heard about us. They even say it's good for Alzheimer.
They're saying all kinds of crazy.
You know what? Maybe you find one good, but like you have so many negative. What you want to just go for one positive and look at all the negatives. And so I would strongly against suggest that if you are smoking, it's a good time to start. Never too late, first of all. If you are smoking, I would advise you to please stop. And the research says if you stop the smoking 5 years later, you are same baseline as the general public. So as you know, smoking increases the risk of lung cancer and other artery disease and heart disease and so many complications that carries. But if you stop smoking 5 years later, your lung status is same as the general public, basically. So it's never too late.
Never too late to stop. Yeah,
exactly. And eating unhealthy, like sugar, as you mentioned, right? So processed sugar obviously is not good for all at all. And processed sugar is not good for you at all. But the healthy sugars like fructose, that's something that inside the fruits, those are also good at moderation. You can even eat, like, for example, mangoes have lots of sugar,
Very sweet.
very sweet, right? So some people say, mango is good for you for diabetes. I said, well, in moderation. It does have fiber, which definitely, if you have anything with high fiber, that cancels out the sugar, right? But again, in moderation. If you have diabetes, mangoes is not good for you because of sugar, right? But for general public, again, if you eat so much mangoes, like 4 mangoes every day, it's not good. Even water. If I tell you this water, I'm giving you like 20 glasses of this water, drink it. That's actually,
I'll become a balloon, right?
your kidneys will fail,
Yeah.
right? So everything in this world is good in moderation. Even the good thing, the water is good for you.
Yeah.
But if you drink too much of it, it's not good for you. So similarly with every other thing, that we have to eat everything in moderation, balanced diet intake, basically.
Okay. So in terms of strawberries, have a good amount of strawberries, have some
Exactly.
watermelon,
Exactly.
have, the mangoes, mango lassi, maybe not too much, so maybe add some sugar in there. You
Exactly.
never
Don't
know.
add the sugar though. You can make it without.
Yeah,
Yeah.
right. You put kefir inside. That's good probiotics and stuff.
Use honey. I would say honey is probably better substitute for the sugar. But even though, because in honey we have, in traditional medicine we have,
Yeah.
the honey is actually good for you.
Antibacterial in some
Exactly.
circumstances as well.
It boosts your immune system and is actually good for you. So you can have a bit of honey, is fine.
Or is like, organic cane sugar,
Yeah,
compared to
it's better
granulated
than
sugar.
the processed sugar. Yeah.
So no Oreos. Inshallah not. Well, I have one last question as well. Just, it's more of, advice that you'd give. Let's say you have someone who comes up to you and they're saying, they want to pursue medicine. They want to become, they want to become a family doctor, or maybe they want to, a profession in a certain, area in terms of medicine, but they don't know where to start, or how can I get a feel for it? Should they volunteer? Should they do more research? Should they talk to people? Should they network? Should they GPT it? That's a lot of people, chat GPT, how do I become a doctor in 10 years, or how do I become a doctor in 4 years in some cases, right? What's a general base guideline or some advice you'd give?
It depends on at what stage they become interested in medicine. In my case, I became interested very late. Like, I was almost done with my master's.
It
right?
shows it's never too late.
It's never too late, exactly. But if you really want to get sense, first of all, I would look at your interests. I don't, unfortunately, in our, Pakistani Indian society,
Arabs,
parents
yeah, no,
and
I know.
Arabs,
I know.
Parents want you have to be a doctor. You cannot be anything else, but you have to be a doctor.
I remember when I told my mom I want to become a cop, she was like, "Nope." I was like, "Okay, I'm sorry."
So it is important to look at the interests of, the child, what they like and what they want to pursue. If you feel that you have some sort of attachment, or sometimes you, like a magnet, you get pulled, a calling, like you get pulled towards it, right? If you have that kind of feeling, definitely you need to look into it. And obviously you start early. Even from high school, like from 11th to 12th grade, you start taking those classes, physiology or biology, whatever they offer. And volunteering, as you mentioned, is a very good start, so you can get sense what you're getting into, right? Get your feet wet, kind of thing, right? I would say maybe talking to a doctor, any general practitioner, family physician, or any specialist, or whatever. Just maybe once a few hours in a week, for example, just go spend some time there, take a look at how the work is evolving, what the work involves, what they are doing. And unfortunately, they cannot have direct patient encounter due to the college regulations. They need to have some sort of clearance and licenses.
Also, client-patient confidentiality.
Exactly.
Liability.
Yeah. But they can look at the background, like how it is, like what it is, and talking to many professionals out there, right? There's so many young doctors and seniors we have in our community, alhamdulillah. And I'm sure if they go to them and talk to them, they will be willing to share their workload and how it is, and get some sense of it. The other thing, the other idea that I have back of my mind is that they can try to get more classes in their pre-medical school. Like, for example, you go to university, they have to take some classes So for any medical school they need to enter, they need to have pre-medical courses.
Yeah.
Once they start taking those classes, they get a sense that what they're getting into. They study about human body, they study about anatomy, they study about physiology, and it's a different world. It's like a medicine. It's like endless. You can just study. You get to learn.
You can write books about the heart, for example. Yeah.
Exactly. It's not simple, right?
Yeah.
So some students, when they look into that, they show some interest. You know what? I like this. I want to learn more about it. This is where that spark, when you have a spark,
Yep.
this is where a spark happens, and then they carry on, right? And then they have to study very hard. Becoming a doctor is very, I don't want to say difficult. It's hard working. You have to work very hard. You have
The
to study.
responsibility is very high as well. Right?
Responsibility is very high, but at the end of the day, it's very fruitful.
Yeah.
You will enjoy it, because once a patient comes to you, you talk to them, you heal them. You basically, you give them something, and they get better with it. You feel that. You feel very special.
The barakah alongside.
But Allah, exactly, because basically shafa is Allah's hand. We are just a wasila. We are just somebody who just helping, right? But we are just we have the dawa, but the dua isn't. We have to do it exactly, right?
Yep.
So it's both. But if they feel that they can, if they feel that they like this kind of work, and they see that how joyful it is, then they put a lot of time and effort that they can continue with this, and they will inshallah succeed with this.
So lots of hard work, and if
Dedication.
you're able, and dedication, hard work, you have to be passionate and look into it early on is better, right? Yeah.
Definitely look early on. Even though if somebody said, what, after 3-4 years of studying something else, they want to become fit, it's not too late. You can study. I actually had a friend when I was doing my residency. He was from I'm not Miss Egypt, I believe. He was like 45 years old. He was an engineer, but he said, I want to become a doctor.
MashaAllah.
And he did it.
MashaAllah.
He's just doing his residency. He's 50 years old right now. He's doing residency, believe it or not. So it is very very few cases, but it happens.
So once you have the calling, listen to it, and
go for
possible. It's always possible.
Go for it.
MashaAllah. I know namaz time coming up as well, and we're short on time. But before we end, I usually like to ask our guests, if you could give our audience one piece of advice, could be any advice, life advice, something you took along the way, something that kind of resonated with you, could be in your journey as a career, could be spiritually. If you'd like to share that, would be awesome.
Well, many advices are there, but I would say, alhamdulillah, we are the lover of Ahlul Bayt.
Alhamdulillah.
Lover of Quran and Ahlul Bayt, alhamdulillah. And this is a huge blessing for us. Nobody else have this. And we should take this for granted. We should really think about it, that Allah subhanahu wa ta'ala has provided us this blessing. That's the biggest blessing we have. And to not let go of this. So you always try to, inshallah, practice the Holy Quran, recite the Quran, and, not to get themselves distance from masajid and marakis, we have in centers, and try to be more involved into these communities. And inshallah, Allah will send the barakah. Barakah. Myself, prior to coming to the medicine, I was also involved into the Holy Quran. I was doing a lot of, learning of the Holy Quran, teaching, memorization, that sort of thing. And I think that has helped me a lot to come to this where I am right now. So definitely, don't let go of that. Don't let go of that. Definitely try to stick with that. Create time for that. Create time to learn and maybe teach. And inshallah, Allah will provide the barakah and ni'mat and blessings in the life.
Exactly. So the same way you need to exercise to keep your heart healthy, you have to show up to the masjid, show up to the centers to keep your heart, the other part of your heart, also healthy.
Or create maybe soccer team, maybe at the center after programs. That's something that,
two birds with one stone.
Exactly. Yeah.
That's all we need, inshallah.
Exactly. Alhamdulillah.
Hopefully the team has some salad ready for us after such a a conversation. I don't want to touch any Oreos, no smoothies, no milkshakes for a while. And inshallah, we long, healthy life for you, and inshallah
Inshallah.
for everyone else, for the mu'mineen and mu'minat.
Inshallah.
Thank you again, guys, for tuning in this episode. Alhamdulillah, inshallah, you benefited as much as I had benefited by his presence and his wisdom and his knowledge. I know for myself, I'm going to have to take my diet a little more seriously again and stay away from the trans fats, stay away from, the processed sugars, and hopefully eat more watermelon instead of cookies. Inshallah, we look forward to seeing you guys next time on the next episode. Thank you again for coming
you so
in
much
such
for
short
inviting.
notice. Appreciate your time and your efforts, and hopefully we'll have you back next time, inshallah.
Inshallah. Thank you so much for inviting me over.
Jazakallah. Thank you
Jazakallah
so
khair.
much. Assalamu alaikum wa
Alaikum
rahmatullahi wa barakatuh.